Welcome again to the First Aid Show. In this episode, we're going to be looking at some childhood problems. And the first one of these is nosebleeds, and the second one is when something gets lodged inside the ears or the nose of a child. Nosebleeds are common in children and adults. They are often easily treated and do not return. Nosebleeds can be distressing to children and embarrassing to adults. Blood vessels in the nose are very close to the skin and easily damaged by putting things into the nose, stress and illness. Nosebleeds can also be from physical impact to the nose or being hit in the face. Be careful in stopping the nosebleed. If you think the nose may be broken or there's external injuries, you need to take extreme care. Treatment for someone with a nosebleed is first to get them to sit down. If needed, calm them down and reassure them. Lean them forward to maintain their airway and prevent the blood coming down the throat, which could cause vomiting or nausea. Get them to pinch the soft part of their nose. This will help to allow the blood to stop, acts like pressure onto the nose. You may want to give them a bowl so that they can spit out the blood rather than swallow it. And if needed, give them some tissues as well. Leave the pressure on the nose for at least 10 minutes and then gently remove the fingers to see if the bleeding has stopped. If it has not stopped, then you can repeat with another 10 minutes. If the bleeding hasn't stopped within 30 minutes, you may well then need to take them to a medical professional. Tell them to avoid sniffing, coughing, blowing their nose, talking, as all these can start the bleeding again and prevent healing. Regular nosebleeds may be an indication of something more serious and a visit to the doctor is advised. Children who suffer from regular nosebleeds often grow out of them without any medical treatment. Children often push items in their ears or up their nose. Other small items can be lodged into the ears or nose and cause injury. Sometimes the object causes no pain, others it can be very painful and distressing to both the child and the parent. Inside the ear is where our balance is controlled, so if an object gets lodged in the ear, it can cause nausea and dizziness, as well as hearing loss and pain. It's very hard to remove an item in the ear, as you can easily push it in, so you must seek medical advice. There is a possible exception where an insect enters the ear. If this happens, you can tilt the head across, so the affected ear is pointing upward, and then carefully pour clean water into the ear. This should mean that the insect will float out. If it doesn't work, you must seek medical assistance. Items in the nose will restrict breathing and can be painful and distressing. If something is stuck in the nose, you must get medical assistance straight away. If you try and remove it, what will probably happen is you'll push it further in and also do more damage. There are lots of blood vessels in the nose, very close to the skin, and these can be really easily damaged as you have any item within the nose. With both the ears and the nose, try to reassure the child at all times and then transport them if necessary to a doctor or to your hospital.